Hey listeners, did you know this episode of Med-Surg Moments is eligible for CE credit? After you listen to the episode, you may claim 0.5 CE hours by following these easy steps. First, log into the AMSN online library at www.library.amsn.org. Then complete the evaluation for the podcast episode and submit to earn your certificate. The Academy of Medical Surgical Nurses is accredited as a provider of nursing continuing professional development by the American Nurses Credentialing Center's Commission on Accreditation. There are no relevant financial relationships with ineligible companies for anyone with the ability to control the content of this episode to disclose. Enjoy the episode.
Big news for our listeners. The 7th edition of the Scope and Standards of Medical Surgical Nursing Practice is now available.
This is the guidebook for all medical surgical nurses.
The Scope and Standards defines medical surgical nursing, outlines the role that a medical surgical nurse plays within a hospital, and reviews ethical issues.
Plus, the guidebook includes, in great detail, the scope of practice and recommended standards for nursing practice and professional performance.
Get your copy today at amsn.org.
On this episode of Med-Surg Moments,
Drumroll, please.
Other big update is that I'm switching to day shift.
I got engaged this weekend, and then we end up by the cliff walk, and I'm like, why are we here? And he's like, oh, the guy, isn't answering. Our topic is caring for LGBTQIA+ patients, including gender diverse patients.
Being open to learning is super important in this situation.
There's a lot of trust that needs to be built.
I'll share a story. I do recall one of my coworkers who refused.
I had been so uncomfortable asking those questions about...
I think we can all affirm dignity without pretending that we share the same definitions, because
what does it really mean to provide inclusive, affirming care?
As Med-Surg nurses, there might be a lot of reasons we might be taking care of this patient. It could be...
If you're a Med-Surg nurse and you're not comfortable with conversations, find a... This is Mary Tess,
Sam,
Eric,
Marcella,
Kellye,
and Sydney. Welcome to Med-Surg Moments, the AMSN podcast.
This podcast is an engaging look at the lives of and surrounding medical surgical nurses.
We're proud Med-Surg nurses just like you, sharing our stories, insights, and experiences to support you in your nursing journey.
Today, we begin a periodic conversation series about AMSN's core curriculum. Our topic is caring for LGBTQIA+ patients, including gender diverse patients, and we'll be discussing the LGBTQIA+ patients chapter in the core curriculum. But before we get started, let's begin with some personal updates. Eric, why don't you get us started?
Thanks, Mary Tess. Drumroll, please. I am back to work. Officially on the floor, ignoring call lights, not running after the bed alarms.
typical.
I was terrified my first day only because being away for like 14 months, I wasn't afraid of the knowledge or stuff or the skills. I was afraid I wouldn't be able to do it. For the last year, I thought I might have to change professions. But I hit the floor running and it's still sore. The doctor said 2 years recovery, but I could do it every day. And I just finished a 6-day stretch. And last night I did a double. I know I said I wasn't going to. I said I wasn't going to work any extra. And then I just couldn't help myself. Someone didn't show up. So I stayed and I couldn't be happier. I love what I do. I couldn't imagine doing anything else. So I'm just over the moon. I'm so blessed and grateful. And I want to thank all of you guys for all your wonderful, wonderful support. Thank you, thank you, thank you.
That's great to hear, Eric.
How about you, Sam? What's going on with you?
Well, I first just want to say your energy is vibing right now. We've been recording these podcasts every month for quite a while, and I can feel how excited you are to be back on the floor. And to me, that is also very exciting. So congratulations. Glad you made it back. Now you just got to stay healthy. No doubles, probably might be pushing it a little bit, that ortho recovery, but what a better way to rehab a broken leg.
Thank you.
So for me, there hasn't been a lot going on. We've just kind of been on cruise control with a toddler, learning how to baby-proof things the best we can, but also not creating false security. So that's kind of an interesting line to draw. But other than that, we're just getting prepped for the summer. We've already started having really nice weather up here in the inland Northwest. So Theo's got his little baby Crocs and we're out at the park and we're really ready for the nice summer weather. So that's about it for me. Marcella, how have you been?
Hello, everyone. Eric, we talked about you in the episode you missed with virtual nursing, the webinar, because we talked about how you could work when out of commission and still be the awesome nurse on the unit. That was so Eric oriented. We thought of you. So congratulations being back. Professional update. Sort of professional, sort of personal, something random that happened. I'm kind of at a new location for the past few months after working somewhere else for 7 years. And I saw on LinkedIn, just by coincidence, that one of my old coworkers and old very good friends that I haven't seen in years because they became a travel nurse during COVID. But we worked on the same pulmonary step down, which was very heavy, great experience I had my first 3 years as a nurse, but very impactful and memorable. And I saw that she had started a new job at my location. It just feels random because it's far away from the place we worked at. And I know she's been all over the country. So I messaged her. I said, hey, I saw you're working for this organization. Which location are you at? And sure enough, it's my hospital. So I'm super excited to actually reconnect. I don't really know a lot of people here yet. So for one of my best friends, especially nursing friends, those are for life sometimes, even if you don't see each other. So we're going to be working a shift together. I'm float pool, so I don't know where I'll be, but we could meet up for a snack or something this coming weekend. Other big update is that I'm switching to day shift. This is huge because I don't even remember the last time I worked day shift. I like it dark. I like less doctors and students. I love students, but sometimes, 10 students at the nurse's station and 5 doctors and residents and students. Oh man, it's overstimulating for sure. As soon as I get there at 7 p.m. usually, I'm like, can we turn off lights, please? So that's going to be a big transition, but I did work my first day shift yesterday and I forgot how much I love connecting with the patients. Usually I have to wake them up in the middle of the night and torture them. And so during the day, I'm able to have more of those Med-Surg moments, those conversations that are the payoff of doing all this hard work. So I really enjoyed my day shift. I'm trying to improve my social and mental health. And I think this is a good big first step in doing that. And then personal update, kind of blended together, but I turned 35. I love birthdays. My husband thinks, I'm a little too birthday obsessed, but birthdays come around and that's the only time that I don't consider myself low maintenance in any way. I call it my birthday week. I want a party. I want Hello Kitty decorations. As a mom of 4, I always put myself last, more than I should. When April approaches, just know I'm going to be on an emotional roller coaster, reflecting on my life, reflecting on my goals. That's the time that I put myself first. And I think I go into a shock sometimes in the month of April because I put myself last the other 11 months of the year. This past year, I worked on finding a job I love that's really working out. And now this coming year, I really want to focus on my hobbies and my alone time without my kids as much as I love them. So I'm excited to start doing that. And a new old friend at work is definitely going to help with that, I think. Sydney, what's going on with you?
Oh, Marcella, that's awesome. Happy birthday.
Thank you.
And happy day shift. Welcome to the sunshine. I think I've always taken for granted day shift because I've always worked in a facility where we had to rotate every few months. At least the military nurses, the civilians kind of did whatever they wanted. But we've always rotated on like a 3 to 4 month schedule. So I forget that some people will go years on nights. And I'm like, oh, I'll see the sun again in a few months. It'll be okay.
That's how I started on nights, but it kind of becomes a little bit cultish. It's like night shift for life. And I took that to heart a little too much.
For me, I think the last time we did personal updates, I was talking about taking a trauma nursing core course. So I just finished that last week and it went great. It was a great learning experience. In that course, we talk about rapid identification of life-threatening injuries. It's like a standardized approach to trauma nursing. So systematic assessments and stuff like that. So it was good too. I'm in a more of an admin role now with clinic management. So it was good to use my nurse brain again. Kind of, all right, well, they have these symptoms or they have an internal hemorrhage. All right, so this is what I would want to do next. And this is what I'm going to ask the doctor to order. So it felt good to use that side of my brain again. For personal updates, I got engaged this weekend. There's the ring.
Wow, that is stunning.
It's so shiny for
Singer's eyes. They're shiny. Yes, he did very good. In Newport, Rhode Island, there's an area called the Cliff Walk that goes along the beach and the cliffs and stuff, which is what we did for our first date. So he took us back there and we got on the rocks and got on one knee. It was a perfect weekend to starting a new chapter.
Did you have any idea or was it like a total surprise?
We've been dating for 8 years. So it was kind of...
Clock was ticking, buddy.
Clock was ticking. He kind of laid some smoke so I would be distracted. I'm the perfect person to surprise because I'm extremely gullible and a little too go with the flow. Like,
I'm
you
the
could
same
be
way.
like, hey, we're going skydiving in an hour. And I'm like, all right. So I didn't even realize we were heading to Newport until we were like going over the bridge. And I was like, wait, why are we going this way? And he's like, oh, well, I bought something off Facebook Marketplace. So we're going to go pick it up. Okay. And then we end up by the cliff walk and I'm like, why are we here? And he's like, oh, the guy, isn't answering. So I'm killing time. Okay. We were on the rocks and he's like, we had our first date here. I was like, yeah. And then it happened. I was like, oh, shoot. Okay.
Wow, that's awesome. Well, congratulations, Sydney.
Thank you. Yeah. So it'll be a lot of planning over the next couple months, but excited for this next chapter. Veritas, what's new with you?
I'm Twitter patting. I'm like, oh, it's so sweet. I need to tell my husband I'm Twitter patting. Like after this, I'm like, you need to marry me again. But that's awesome. That is so, I am like, my heart is really beating so warm and fast. Like, that's amazing. Congratulations, really.
Thank you. We're very excited.
Well, personal updates. I wanted to share the last time I said I'll have a short trip, and it did happen. I had a very, very quick short trip in the Philippines, and I was overseas for 5 days. Total 5 days. And it was more of like a family reunion. So if you're going to ask me, would you rather have a short vacation or a long vacation? I'd rather go for like the shorter ones because you plan your things ahead and it's more meaningful. I wish I could do another one if my PTO is there. Nurses Week has been so busy. Been doing proclamations for different counties in Florida, celebrating the nurses. I was in the AMPD conference. I actually saw Laura Johnson, who was our former co-host in Med-Surg Moments, and she presented a podium presentation. I was so proud of her. I'll tell you, it was standing room only. Everybody was just there full, and it was so energetic. It was so informative. I was really in my starstruck friendship moment. And I was there taking pictures, taking a video. I'm like, this is Laura. She's my friend. I know her. It was very inspirational. And I saw a lot of Med-Surg nurses there too, who are also nursing professional development practitioners. So it was just a very cool moment. Why don't we move on to our topic, our first installment in a new periodic core curriculum conversation series. We're talking about LGBTQIA plus patients chapter, specifically caring for gender diverse patients. What does it really mean to provide inclusive, affirming care for gender diverse patients? And how can Med-Surg nurses create safer, more supportive environments for our patients? Who would like to get us started?
I think one of the first steps for providing inclusive care for gender diverse patients is establishing some trust between the healthcare provider and the patient and keeping a nice open line of clear communication just so that everybody's on the same page. Their name, their gender identity, all of those different things, just to make sure that we have that foundation so that we can appropriately address whatever their healthcare concerns are or preventative care or whatever it may be.
The chapter does a great job of kind of getting you caught up on terminology that is constantly changing. Even in a couple years, this might change. But for you to use on the floor right now to have the conversations with those patients and let them know, hey, I took my time to be able to talk to you about this by learning all these terminologies, and I can have that conversation with you. You can teach me. I think that's a big thing too, is being open to having that conversation with your patient and letting them teach you as much as possible, because it's happening real time. Things are changing every day. And these terms are so fluid that patient might have other terms that they prefer or that they want to talk about. And being open to learning is super important in this situation.
Marcella, you bring up a good point about how terminology changes at the drop of a hat. And what's nice is, even if the terms that we have, like the ones we have currently right now, for all we know, it could change tomorrow. But what it does is it shows the patient that you're learning and that you're willing to learn, as opposed to being closed off. Back to what Sam was saying, it's about trust. There's a lot of trust that needs to be built.
I'll share a story. I do recall one of my coworkers who refused to take a patient. But she refused because, I would say, more of a positive note, because she wasn't sure what to really do when she had a transgender patient. And so, to everyone's point, understanding the terminologies, understanding what it means, but it's also very important for us nurses to train ourselves, to educate ourselves. I really admire that she said, I don't want to take this patient right now because I don't want to offend. There is openness. But what is so admiring with our charge nurse at that time was when she said, just be open, be honest, tell the patient this is your first time taking care of the transgender population. And so she did that. And the building of the trust, the building of that relationship was there. But at first she was really trying to say, I don't know how to take care of the patient. It can be intimidating at all. I have a lot of transgender friends. My brother is openly gay. My son is openly gay as well. And I asked for their permission if I can talk about it too. And I do think it's so important that we're open. Like you guys were mentioning about the trust. That openness comes with getting exposed to situations, circumstances. So practice role playing. If you're a Med-Surg nurse and you're not comfortable with conversations,
we're going to pause for a quick moment to tell you about a special AMSN membership offer just for you through the end of this month.
Hey, Med-Surg Moments listeners.
We have an exclusive offer for you.
When you join AMSN by June 30th, 2025, using the code AMSNPOD,
You will receive $5 off your membership.
Visit amsn.org/join and be sure to enter AMSN-POD when you check out.
Okay, we're back.
If you're a Med-Surg nurse and you're not comfortable with conversations, find a mentor, find someone where you can do a role play that would help you gain insights with a proper way on how to open up a conversation, I would say.
That's great that your coworker was able to recognize. We do learn about this with some other topics of recognizing your bias. And I think we can all affirm dignity without pretending that we share the same definitions, because we're in the middle of lifestyles, politics, changing policies, best practices updating all the time. We can do both. We can recognize we don't know or we're not sure. And new nurses are sometimes asking, like, how do I do this? How do I do this? Go in there and ask them questions. They will love to answer questions, some of them. If not, just leave the space for them to talk.
Absolutely. You don't have to go in there pretending that that is your area of expertise or that you know everything you need to know about it. You need to be open to learning new and be accepting and being able to be taught by someone in the area from that population.
And I know some of the navigators, like admission navigators, are actually starting to guide you a little bit with this conversation. Actual prompts I saw in my new organization. I have to edit them a little bit for like an older population sometimes because I don't want to confuse my patients either. And this is really important regarding preventative care. And the core curriculum talks about this a little bit to ask people about their specific body parts and what they have. And that can be an uncomfortable conversation, but this is so important in regard to getting your annual prostate exam, cancer screenings, and the chapter talks about this. And so if we just kind of also remember to bring it back to the clinical, we want to help you, we want to take care of you, and whatever clinical questions we ask other patients, we want to make sure we get down to the nitty gritty with these patients too. We got to get down and personal sometimes.
Yeah, I think it's especially necessary because there's a lot of additional challenges that community faces that some people outside of that community might not. Using anatomical language or knowing what they're personally going through, still treating them as a patient, not just like a member in a community, but also identifying that community has specific risk factors and that there's specific health disparities that are faced by that community.
I really liked what Marites was saying about finding a trusted coworker or mentor that can help with some of that role playing or rehearsal of these uncomfortable conversations. And I think that can apply to a lot of different things. I personally, in my nursing practice, don't really have any experience caring for gender diverse patients. I took a similar tactic when prepping to talk to patients with suicidal ideation through the Columbia Suicide Scale. I had been so uncomfortable asking those questions about, have you tried to harm yourself, harm others? I ended up coming up with a nice, respectful introduction of like, hey, I need to ask you some questions. They might make you feel uncomfortable, but it's really important for your care that we have the answer to them. And I think a similar approach is what I would do if I was taking care of a patient of this gender diverse community.
Yeah, there's one thing that the curriculum mentions about explaining why you need personal information so that the inquiries don't come across as intrusive or just curious, explaining that we're asking those questions specifically to better take care of them.
I thought it's interesting to quote one part of the curriculum, which is the transgender specific healthcare. Part of it was from the survey. I'll quote the survey. The report is The Injustice at Every Turn, a report of the National Transgender Discrimination Survey. And what really struck me a lot there was 40% felt harassed when presenting identification. That really struck me a lot because that's 40% of our population. So if they felt that way, that they don't feel safe in this space, how are they going to get healthcare? If we are not comfortable asking those questions and they have that feeling already coming into the hospital, then how are they going to open up with what they're exactly feeling, why they're coming to the facility?
As Med-Surg nurses, there might be a lot of reasons we might be taking care of this patient. It could be something acute, unrelated to their sexuality, to their gender identity, but it could also be aftercare or gender affirming care, recovery, post-recovery care, or it could be acute, something completely unrelated. I have never personally taken care of someone who's there for gender affirming care. I have taken care of patients that are in this population for other unrelated things. They're people. They have heart failure, they have COPD, and we're going to see them for every random thing. But I think it's still important to follow up if they do have a history of any kind of gender affirming care, whether it's hormone therapy, surgical intervention. I think it's really important to follow up because the component that is forgotten in a lot of mental health situations is that the mental health aspect is forever. And also any complications or aftercare is lifelong. So I think it's important, even if they're there for something else, that the doctors have the conversation, a follow-up of how they're doing after these procedures.
And one thing to kind of bounce back to what Sam and Mary Therese were talking about with practicing these conversations, one thing that's great about the core curriculum is that it offers a case study for dealing with the trans woman. And then it gives you objectives and outcomes using the curriculum of how to go about that situation. If you don't have a trusted coworker or friend that you can kind of bounce those conversations off of, you can use the core curriculum itself as a resource for stimulating those conversations.
That part of the core curriculum actually really is so informative. It's a great little snapshot of assessments and medications and, like I said, the gender affirming surgeries. It's really a great little tool.
I wanted to say it's more of a reference for you to advocate for your patient because you're the person who's really going to advocate. I remember, I'll share one story. It was a situation where the nursing supervisor would really want this patient to be with a male patient. She is transgender, biologically male, and they're pushing for her to stay with a male patient. I said, no, she needs to have a private room because that's her preference. We need to advocate for them. We need to respect. We need to provide a safe space for them in order to build that trust, because if not, no one else will.
I think the only gaps that I wish we talked about a little more, because I feel like silence around certain topics doesn't help anyone. It doesn't help these patients either, recognizing that it's a long road after these procedures, whether it's hormone therapy or surgical intervention. Back to our nursing course, informed consent. If you're in a situation where you feel like the patient really needs to have that informed consent of the long-term goals, like a heart transplant, a lung transplant. I remember waiting with patients somewhere on our unit for up to a year before these big procedures. They kept thinking of the transplant as like this finish line. Mental health is so complex. These disorders of body dysmorphia, they're so complex. To just kind of generalize, gender-affirming surgery saves lives, and in many cases, they feel that it is saving their lives. But that informed consent is so important to know that after your procedure, there's lifelong complications, infections. And I think informed consent is part of our big obligation. So I just wish you would touch a little more on the long-term effects of these things and how we can talk to our patients about that too. And mental health support. What do we as Med-Surg nurses know when we have a mental health patient on our unit? Unfortunately, because of resources, sometimes the focus is on medications and procedures, but you need alongside that the support with therapy. And I think that's a lifelong thing too, that I hope that caregivers and doctors and the teams surrounding this population don't let go. Just like with mental health, because of the resources, a lot of times people are lost in the conveyor belt of a psychiatric facility, and it's mostly pills, and there's just not enough money for everyone to get the therapy that they need alongside that. So I think the conversation around the hard topics, we shouldn't be so afraid to talk about them, but I understand that it's hard because this is still changing every day.
Well, believe it or not, we're just about out of time. But before we close, let's go around and have each of you share your biggest takeaway from this conversation and the LGBTQIA plus patient chapter in the core curriculum.
I would say that my biggest takeaway is just to make sure that I am staying informed. I think I've been able to get by with a fairly basic knowledge of the LGBTQIA plus community, but I know for myself, after some reflection and reading through this chapter, that I have more work to do on my own. So I'm definitely going to own that and take that.
I think for me, seeing the statistics that were listed in the curriculum was really eye-opening, and it really put an emphasis on why this chapter is so important, and it is part of and should be part of nursing curriculums. It's a community that faces disparities, and it's a community that we see, even if we don't realize it or we don't talk about it as much as we should, acknowledging what this community goes through and how we can help as nurses.
My biggest takeaway from the curriculum was the way they approach the assessment with dignity and respect, just like you would any other patient, with just being a little more conscious of your word choices and the terms you use. It's about offering a safe environment for all patients.
It kind of summarizes everything to being kind. You know, as nurses, we are kind, we care. Having that safe environment, no discrimination, no biases, and being able to give the best care possible for every patient.
My biggest takeaway is that compassionate, informed care is crucial. And it's just a reminder that the rapport with our patient is so important. We get put in these very personal situations with our patients, and sometimes we're the only person they can talk to. And it is such a privilege to be that person.
Be sure to check out the show notes for this episode. We've included a link to where you can get a copy of the AMSN core curriculum. Thanks for joining us. We'll see you next time.
We look forward to connecting with you on the next episode of Med-Surg Moments, the AMSN podcast. In the meantime, we encourage you to subscribe to Med-Surg Moments wherever you listen to podcasts.
To reach us, use hashtag MedSurgMoments on your social posts.
Or send us an email at amsnpod@amsn.org. That's amsnpod@amsn.org.
We are all AMSN members, and if you love Med-Surg Moments, we invite you to become a member of AMSN. You can learn more at www.amsn.org.
Finally, the content within the Med-Surg Moments podcast represent the views, thoughts, and opinions of the co-hosts and may not necessarily reflect the views, thoughts, and opinions of the Academy of Medical Surgical Nurses.
Until next time, this is Eric,
Mary Tess,
Sam,
Kellye,
Marcella.
and Sydney. And always remember, Med-Surg Moments is a moment in our lives and a moment in our Med-Surg careers that makes a huge difference.